Have you ever wondered what really happens to your body when you go a long time without sexual activity? Does your body hit the reset button, giving you secondary virginity? And is that even a thing? What about your hormones, your menstrual cycle, your eggs? And let's not forget libido. Does it fade away or does it come back stronger? Oh, and if you're on contraceptives, should you stop taking them if you're planning to abstain? Or is it better to stick with them? What happens to your body when you remove contraceptives during a long period of abstinence? These are some of the questions I've seen pop up in my DMs, and I know you're just as curious as I am. So today, we're diving into all of it. But first, let me ask you, how long have you gone without sex? Be honest. What did you notice about your body or your emotions during that time? Did anything surprise you? Drop your experiences in the comments. I can't wait to hear your stories. I know we have a lot to cover in this video, so let's jump right in. And trust me, you'll want to stick around because we'll be tackling what happens to men in the next video. Wait until you hear that. If you're not already subscribed, hit that button so you don't miss it. What happens to your cycle? First things first, does abstaining from sex affect your menstrual cycle? The short answer, no. Your cycle operates as part of your body's internal ecosystem and isn't influenced by your sexual activity, or lack of it. If you're not on contraceptives, your cycle will continue as usual, following its natural rhythm. Your sexual activity, or lack thereof, doesn't press pause on that. So rest assured, your cycle stays on track. Now, let's talk about men versus women in sexual desire. Here's something fascinating. Men generally experience sexual desire more quickly than women. Let me explain it in a way you can relate to. Imagine walking into a building with motion sensor lights. The lights flick on the moment they detect movement. That's men. A glance, a thought, or even a suggestive book can ignite their desire. Women, on the other hand, are more like an old-school analog switch. You need to go up to the switch and physically flip it on. For most women, it's about emotional or physical contact. Things like touch or connection often play a bigger role in triggering sexual desire. This difference can actually work in women's favor when it comes to abstinence. Women can maintain longer periods of inactivity without as much difficulty. But it's worth noting that for women in relationships, the desire often resurfaces when there's an emotional or physical bond. What about your ovaries and eggs? Here's a question I get a lot. If I'm not having sex as a woman, does it mean I'm not releasing eggs and I get to save them for later? Great question. Here's the deal. Women are born with a full set of eggs at birth, about 1 to 2 million. By the time you hit puberty, that number drops to around 300,000. And every month, regardless of whether you're sexually active, your body releases an egg during ovulation. If it's not fertilized, your body simply reabsorbs it and the cycle repeats. So no, abstaining from sex doesn't save your eggs. Your body continues its natural process, whether you're having sex or not. What happens to your body during long periods of sexual inactivity? Let's dive into what actually happens when you stay without any sexual activity for an extended time. And yes, we'll touch on secondary virginity shortly, but first, let's cover the most burning questions. Your eggs and reproductive system. Once you hit puberty, your eggs start maturing, and every month, ovulation happens, whether you're sexually active or not. Your body releases an egg during ovulation, and if it's not fertilized, it's reabsorbed, leading to your menstrual cycle. Over time, the number of eggs diminishes. This depletion continues regardless of whether you're having sex or reproducing. When your supply of eggs runs out, you hit menopause. This marks the end of your reproductive period and comes with its own set of challenges, like lower estrogen production. We'll dive deeper into managing menopause and its effects in future videos. Libido, the rise and fall. Libido, or your sex drive, can go through noticeable changes. While a small percentage of people might experience an increase in libido during periods of abstinence, the majority find that their sex drive decreases over time. Why? Your body has an efficient way of sidelining things it considers unnecessary. Without regular sexual activity to stimulate hormones like oxytocin, the love hormone, and dopamine, the reward hormone, your sex drive may naturally dip. These hormones are vital for emotional bonding and pleasure during intimacy, but when they're not regularly triggered, your body simply adapts. However, this doesn't mean the libido is permanently lost. It's just dormant and can resurface with the right stimulation or a rekindled connection. Physical effects on your sexual health. When you're not sexually active, your body's sexual systems may not stay in their ready state. For instance, vaginal lubrication. The glands responsible for lubrication may produce less over time as the body deprioritizes them. Sexual response. After a long break, you might take longer to feel aroused or achieve orgasm, as your body essentially has to dust off its systems. But don't worry, this is temporary. With time and regular activity, these systems can bounce back. Sexual frustration. Psychologically, some people experience sexual frustration after prolonged abstinence. This can manifest as physical sensations, such as heaviness or sensitivity in the labia, clitoris, or breasts, as your body signals its unmet needs. While masturbation can provide temporary relief, it's worth noting the risk of developing it as a habit. Finding alternative activities to redirect your mind, like exercise or hobbies, can help manage these feelings. The immune system and sexual health. Sex has benefits for your immune system, and studies suggest that regular sexual activity can boost it. It also helps flush out bacteria from the urethra, reducing the risk of some urinary tract infections, UTIs. However, abstinence can reduce the risk of sexually transmitted infections, STIs, and sexually associated UTIs. Why? There's no partner introducing bacteria into your system, and the chance of bacteria being pushed from the anal area to the urethra during intercourse is eliminated. Secondary virginity. Now let's tackle the concept of secondary virginity. Prolonged abstinence might make your body feel reset sexually. Psychologically and physically, this can include reduced sensitivity and lubrication, as we mentioned earlier, a longer time to feel comfortable or ready during intimacy when you resume sexual activity. But remember, this is temporary. Your body is adaptable and can return to its usual responsiveness over time. Virginity is often associated with having an intact hymen, a thin membrane that can tear due to sexual activity, physical activities like bike riding, or using tampons or toys. If your hymen is torn, it doesn't grow back. However, if you abstain from sexual activity for a long time, your vaginal walls may become thinner and less elastic, which can make penetration uncomfortable. This is not secondary virginity, but simply a natural response to inactivity. Regular sexual activity helps strengthen pelvic floor muscles, which are crucial for bladder control. Prolonged abstinence can weaken these muscles, leading to mild urinary incontinence, such as leakage during sneezing or coughing. To counter this, you can do Kegel exercises. Tighten the muscles you use to stop urination and hold for a few seconds. Yoga is also a great way to support pelvic floor health. Some people notice a cleaner feeling during abstinence because there's no exchange of fluids or friction. The vagina is self-cleaning, and without sexual activity, secretions and debris from epithelial cells are minimized. Normal discharge still occurs, such as ovulation-related secretions or post-menstrual cleaning, which are natural and harmless. If you're abstaining, you may consider stopping contraceptives, especially hormonal ones, to avoid unnecessary side effects. Non-hormonal options like copper IUDs can also cause reactions in some people. Once contraceptive effects wear off, your body will usually return to its natural cycle. However, remember that once you're off contraceptives, the risk of pregnancy is higher if you become sexually active again. If you've abstained for a long time and decide to resume sexual activity, be aware that initial discomfort is normal due to reduced elasticity and lubrication. Communicate with your partner and give your body time to adjust. Over time, things will improve naturally. Abstinence is a personal choice and a natural method of contraception. If you choose this path, focus on maintaining pelvic floor strength through exercises like Kegels. Should you resume sexual activity, patience and preparation are key. Everyone's body responds differently, so listen to yours and adjust accordingly. Let me know how long you've been abstaining and what changes you've noticed in your body. Share your thoughts in the comments, respectfully and with an open mind. Don't forget to like, share, and subscribe.